Have you ever thought about controlling high blood pressure without medication? Many people believe that the only solution for hypertension is to take pills for the rest of their lives. But the truth is that, in many cases, it is indeed possible to improve blood pressure naturally. In some cases, you can even reduce the dosage of medications and, with medical supervision, eventually stop altogether. Today, I will show you what really works to lower blood pressure without medication. No miraculous tricks or empty promises. What I am about to share with you is based on science, on serious studies, and can make a big difference in your health and life. Hypertension is one of the most common diseases in Brazil and worldwide. Over 30% of adults have high blood pressure, and the most frightening part is that almost half of them don't even know it. This happens because most of the time, high blood pressure shows no symptoms. It is silent, dangerous, and can cause heart attacks, strokes, kidney failure, and even dementia. But there is good news. It is possible to control blood pressure and even prevent it with simple habits without relying solely on medication. Let's understand this together. The first step is weight control. Excess weight is one of the main factors that increase blood pressure. And the logic is simple. The more weight the body carries, the more the heart needs to work to pump blood. This causes the pressure to rise. But here's an interesting fact: for every kilogram you lose, your blood pressure can drop by about 1 point. In other words, if you lose 10 kilograms, your blood pressure can decrease by around 10 points. This is equivalent to the effect of a medication. And the best part is that it doesn't have to be a drastic change. Losing just 5% of your body weight already brings huge benefits. So, if you are overweight, the first step is to start losing weight gradually and healthily. The second point is to reduce salt intake. The average Brazilian consumes twice what they should. The problem is that this excess doesn't always come from the salt shaker, but from processed foods, such as cold cuts, ready-made sauces, powdered seasonings, snacks, and frozen meals. Salt causes the body to retain fluids, increasing blood volume and, consequently, pressure in the arteries. Reducing salt is one of the quickest ways to lower blood pressure. And you don't need to cut it out completely. Just avoid excess and replace ready-made seasonings with garlic, onion, herbs, and lemon. These natural seasonings add flavor and also bring benefits to the heart. Now let's talk about diet. One of the most studied and recommended diets for those with hypertension is called the DASH diet. It is based on fruits, vegetables, legumes, whole grains, and foods low in fat. This way of eating helps not only to reduce blood pressure, but also improves cholesterol and glucose control. And all of this happens because she is rich in potassium, magnesium, and calcium, minerals that help blood vessels relax. You find potassium in foods like bananas, avocados, spinach, potatoes, and beans. These simple choices already make a huge difference in how the body functions. The fourth point is regular physical activity. Doing physical activity is one of the best ways to lower blood pressure naturally. When you move, the heart becomes stronger and can pump blood with less effort. This causes blood pressure to drop. Walking, cycling, swimming, dancing, any exercise counts. The ideal is to do at least 150 minutes per week, which is 30 minutes a day, 5 times a week. If you don't like the gym, walking alone is enough to start. And over time, the body responds. Additionally, light strength exercises like weight training also help. They improve circulation and reduce stress, which is another important factor in high blood pressure. Talking about stress, this is the fifth point. Constant stress is a silent enemy of the heart. When we live in tension, the body releases substances like adrenaline and cortisol, which increase blood pressure and overload the body. Therefore, it is essential to find ways to relax. Practice deep breathing, meditate, listen to music, do something you enjoy. All of these help. And it doesn't have to be complicated. Taking 10 minutes a day to disconnect and breathe calmly already helps regulate the body. The sixth point is sleep. Getting good sleep is fundamental for blood pressure control. When you sleep little, the body remains in a state of alert, as if in danger all the time. This causes blood pressure to rise. Ideally, sleep between 7 and 8 hours per night in a dark and quiet environment. Avoid cell phones and television before bed. Your body needs this rest to recover and balance hormones. Now, a point that many people ignore: alcohol. Excessive alcohol consumption increases blood pressure and interferes with medication effectiveness. Even in small amounts, alcohol makes a difference. Men should limit their intake to a maximum of 2 drinks per day and women to one. But the best approach is to reduce it to the minimum possible. The less alcohol, the better the heart and liver function. Another essential factor is to quit smoking. Cigarettes do not immediately raise blood pressure, but they damage blood vessels and harden the arteries. This causes blood to circulate less easily and increases pressure over time. Quitting smoking is one of the best decisions someone can make for their health. It improves circulation, lung health, heart health, and even skin. And here's a point that many people don't take seriously: hydration. Drinking enough water helps the body eliminate excess sodium and keeps the blood flowing healthily. Many people with high blood pressure drink little water, which overloads the kidneys. So, drink at least 2 liters a day or more if you exercise. Now that you understand what really helps control blood pressure without medication, I want to emphasize one important thing: never stop taking medication on your own. The changes I showed here are complementary and help the treatment work better. Over time and under medical guidance, it may indeed be possible to reduce the doses. But this needs to be done safely and with supervision. Controlling blood pressure is much more about how you live than about what you take. It is a set of daily choices that, combined, change your body and your health. If you eat well, exercise, sleep properly, avoid stress and alcohol, your heart works better and your blood pressure stays balanced. I am Eddie Rodriguez, and this is the EDU Health Tips channel. If this content helped you, share it with those who need to know about it. Like the video, subscribe, and activate the notification bell so you don't miss the next tips. Tell me here in the comments, which of these changes are you going to start applying to your routine? See you next time.